Today I'm talking with Zahra Poonawala. This is Zahra who comes from Pune. And Zahra Poonawala is one of the star psychologists here of the region, and she has a huge knowledge and an answer to so many questions that it's really interesting to make these podcasts or video podcasts with you. Zahra, thank you very much that you're coming for the video podcast.
Thank you for all the kind words that you said.
It's actually very nice. Yeah, so, but anyway, it's not the first time that we're doing this. We are already good in this, and or not, depending on what the people think, but I think we are good. And it's fun, actually. It's fun.
It is. It's a lot of fun doing this.
We have also new seats. Yeah, the labels are still there. I don't know if the label is still on the. Is also on the camera. Yeah. So, how do you like the seats?
They're super comfortable.
Yeah.
And I think it's so important to have something really comfortable to sit on, especially when you are in therapy as well.
That's actually nice. There are some pillows missing.
Yeah.
You're probably right.
Yeah.
You know, I found them. They were. It's not cheap furniture, so it's good furniture. Yeah. Durable. Yeah? Anyway, completely talking out of topic.
No, but it's really interesting that you bring up the pillow seat, the seats of the chair, because again, just taking it back to therapy rooms, when people who are processing really difficult things, it's kind of and are feeling unsupported.
Yeah.
So people who might have undergone trauma, it's really nice to have like a comfortable chair to sit on, because you can kind of create that sensation of sort of feeling really supported and grounded in their body with the support of the chair.
That's what I was feeling, actually. It's like in my sport car seat with the like support from the side is actually quite good.
Yeah.
You just mentioned trauma. How do I know if I have a trauma? Do I know that I have a trauma?
Everybody has trauma.
Really?
Yeah. So basically, trauma is if you had to put it in layman term, trauma is something that is like a life-threatening experience, or like an experience where your sense of safety sort of gets shaken up. And it's not only like something traumatic like having a violent attack or like getting into an accident and injury. It also could be very simple moments where you've sort of felt isolated or felt really unsafe so as a child, maybe a child who has like an adult or a teacher coming down on them hard, that could also be like a traumatic event. So through all our lives, we've all sort of been through some sort of trauma.
We know as surgeons, we know trauma like a broken bone or, or like an injury, a cut in the tissue. Yeah. And usually it leaves behind a scar.
Right.
And how is this with our psyche? This kind of trauma that is just an experience.
Right.
Yeah? As you describe it, so the people have an experience and that experience is life-threatening or it's acknowledged as life or felt as life-threatening experience. And does that leave something similar to a scar?
Yeah. So with trauma, it's not actually the experience that has happened to you. So it's not the circumstances, but how the individual actually subjectively processes that experience. And that's what sort of leaves the scar that we kind of have. And with prolonged time, you will kind of start, like the memories of it might start to fade away. But when there is a trigger, so it even could just be like a simple smell that was present when that traumatic event took place, that would then trigger back all of those painful memories and kind of dysregulate you as well. So that's the scar that you're sort of referring to.
Yeah. So basically it's just like a wiring that is still there.
Yeah.
And that is somewhere hidden
in the back.
In the somewhere in the back of the subconscious area of the brain, and then it can be reconnected.
Right.
By for example, a smell.
A smell or a song. So sometimes you might notice when you're driving your car
Yeah.
and you're listening to a certain song, it will bring up
Yes,
certain
absolutely.
memories for
Absolutely,
you. So
yes.
it could be a song, it could be like, I've worked with a client in the past who had an aversion to the color
Yes.
yellow.
Yes.
And through our sessions, we sort of discovered that the day her dad passed away in the hospital, the curtains in the hospital were yellow.
Yes.
So that became like a symbolic
Yes.
threat in her
Yes.
mind as something painful happening in the moment. And that's the tricky part about trauma. We might be actually acting out of trauma, but we may not necessarily know that we are. And then we regress back to that time, and then we respond to our present based on the past.
You know, you said something that is actually probably connected to my question that I was always wondering about. If everybody had traumata, is it then so bad that we have that we have it? Isn't that normal that everybody has some kind of scars of
Yeah.
or scars
Yeah.
as I describe it in their
Yeah, yeah.
memory?
It is. It is very normal for everyone to have some of those emotional scars. The time that this starts to actually become a problem is when you start to experience symptoms where you cannot then start to function normally on a day-to-day basis.
Yeah.
So you might notice that if I had to just list out some symptoms for you, it might be like when you have aches and pains in your body, you have this headaches, you have inability to sleep, and there's no real apparent reason that it's happening. What has happened is due to the trauma, your nervous system is in this aroused and hypervigilant state, and it's just kind of preparing for something bad to happen, but there's actually nothing bad in the present happening to you, but your body is just constantly responding
Yeah.
in preparation for that threat to sort of
Can you
surface.
give a more practical example?
I'll give you a more practical example. So again, recently I was working with this patient of mine, and he's this 30 plus gentleman, and he has he's just completely sort of isolated from himself, and he finds it really difficult to build relationships with people. His marriage started to struggle because of that as well, and through therapy and through the process of sort of uncovering what was going on, we sort of noticed that in his childhood he had this really strained relationship with his mom, and so the mom, being like a primary caretaker and a big attachment figure for this child, was emotionally unavailable for him.
And that was a trauma.
And that was the trauma for him. And how did that transpire into adulthood? He was just always scared to sort of be open to people and connect with people, and instead chose to isolate himself, because then an external figure cannot cause him pain.
Yeah. Okay, good. Another example.
That
was an example difficult to understand for me.
Okay.
Difficult to. Maybe for everybody else easier, but for me not so.
No? Okay, so let me try. Okay, let's just keep it really simple. So, for example, if you lose someone in an accident all of a sudden, right? Just that shock from having that sudden sense of loss could be a trauma.
That I know. For example, I know from my own experience. I remember when my father died, I was listening, probably deliberately, to a sad song. And somehow it connected very much to this incident.
Right.
And this is, now so many years back, because my father died when I was 17. And always when I hear this song, I start to cry. Yeah. So although, it's also a sad song, or a sad melody somehow, but it's just coming up whenever I hear Steve Harley, Sebastian, it's just coming up. Yeah. And, but that's something that is not really bad. I somehow enjoy that feeling. Not that I enjoy the feeling, but somehow it's just nice memory somehow.
Yeah. So that song, in essence, sort of became a coping mechanism
Yeah,
for
could be,
you.
yeah. Mhm.
Yeah, where you sort of earlier sort of associated with the memory of dad,
Yeah.
and then when you listen to it, it not
Yes.
only brings up losing him, but also all the other things that are
Yes.
attached to
Yes.
him.
Correct. Yes.
Yeah.
So that's not a bad thing. It's not a
That's-
trauma.
It is a like the loss of your father is trauma.
Yeah.
You found healthy ways to deal with
Yeah.
it. So over time, it's become a healthy way of
Yeah.
dealing with it.
Yeah.
But if even today, if you were then unable to function
Yeah.
and do your job or have
Then
your
I would switch
like,
off the music. Actually, I
Yeah.
would not put the music on when I have to function. Yes. Yeah.
yeah.
But
But like if you deliberately started to switch off the music as well, that would then be avoidance, if that makes sense, where you're not trying to feel the pain. And that's what therapy does. It helps you sort of focus on that emotional pain that you're going through and process it versus push it down and push it down and push it down.
But wouldn't that mean that I mean, isn't it okay if it's just disturbing at that moment? Let's
Yeah,
say I
yeah.
have, for example, now I want to make a podcast with you.
Mm-hmm.
It would be a stupid idea now to put on the music that triggers
Yeah.
for me sadness.
Of
Yeah,
course.
although also nice memories, but
Yeah, yeah.
also sadness.
Yeah.
So it's not. It's a good avoiding. Yeah.
Yeah. But when you've processed that, that's why you can even talk about the loss of your dad without physically feeling all of the
Yeah.
symptoms of like crying
Yeah.
and like all of the
Yes.
things associated, different sensations associated with grief.
Yeah.
Yeah, so you've sort of processed it. People that come into therapy may not necessarily have processed it.
Yeah.
So then that song would immediately trigger like
Yes.
this really strong response.
Yes.
And the song in itself is like neutral. It has nothing to do with anything.
With anything,
But
yeah.
we've sort of projected onto the song all of this meaning.
So then, does every trauma has some kind of a trigger then after a while?
Yeah. So with trauma, like if you don't process it, that's when it starts to become an issue because we're not addressing that pain that
Yeah.
we're sort of experiencing. We are pushing it down and then picking up our phones and looking at our phones, or we're watching Netflix, or then
Yeah.
we're like diving deep into work maybe
Yeah.
as a way to not cope with
Yes.
all of those intrusive thoughts.
Yes.
And that's when it starts to become like a issue, because then you're using all of your mental energy to push it down versus actually address it.
Yes.
And that's the non-addressing part of it, is the avoidance,
Yeah.
or like commonly known as the flight response.
And what do you do so let's say I have had a trauma and I forgot about that trauma. And let's stick to the yellow curtain, for example. Yeah.
Yeah.
And then so what would be my symptoms then later? Maybe that I cannot eat scrambled eggs because of that, or something like this. Yeah.
So this client of mine had like severe aversion to yellow.
Yeah.
So even if she saw it like on a brochure,
Yeah.
or like if someone was clothed in yellow,
Yeah.
she would experience this extreme sense of anger and rage, or not want to interact with that person. And this is when it started to sort of impact her day-to-day life.
Yeah.
And yeah.
And then you figured that out.
Yeah.
That this yellow was connected to this trauma.
Yeah.
And then how did you help her to accept yellow sport car?
So she then, we started to kind of process all those unprocessed emotions associated with her father's death. There were all of these things that she wished she had said to her father, because they also had like a very turbulent relationship with each other. So then using different therapeutic tools and interventions, we then began to reframe that experience and kind of break that learning, that association that yellow is equivalent to something bad, and create that awareness that not all yellow is.
And that helps?
Yeah, it seemed to work for her.
Yeah. Because I mean, yeah, I can understand that. So basically you reduce the trauma in itself
Yeah.
It's not a trauma then, not necessarily
So
a trauma.
it's not the trigger that is the problem. It is what meaning you've associated to that trigger that is the problem.
Yeah.
So whatever you've not
I
processed
get
there
it.
is
Yeah.
what is the issue there.
So if the yellow curtains
Was green,
tell me, damn, now it's too late, I cannot say all the things anymore that I wanted to
Yeah.
do, or
Yeah, but it was not only just when her father passed away. It's also like that entire history from her
Yeah.
childhood of having
Yeah.
those very turbulent interactions with each other,
Yeah.
which were just based out of a lot of angst and aggression, and so
so all this accumulated, and finally
Finally
yellow was the color that stands
Yeah.
for the entire mess.
yes,
And that and then you basically unraveled the mess and cleared that up, and
yeah.
then the yellow
yeah,
was then without a meaning anymore, because there was
Right.
nothing, no content in the yellow box
yeah,
anymore.
yeah.
That's amazing. So but that takes a while, I think.
It does. It does. It's also really scary to work with with your own personal trauma, because there's all of these uncomfortable feelings that sort of surface and come up, which you have successfully been pushing away all of this time, and so hence it's like super important to be prepared and find a therapist who is going to provide you that sense of comfort and safety. And non-judgmental support
Yeah.
as you sort of navigate through that as well.
Yeah, because there may be more traumas popping up.
Yeah.
Traumata.
Yeah.
The plural. So one trauma, many traumata. Is it correct? Yeah.
Yeah.
Traumata. So so this is trauma experience, trauma treatment.
Yeah.
Um,
And like a lot of times, even people who get diagnosed with anxiety and depression and things like that, sometimes they might get that diagnosis, but they may not actually, people may not be able to explore that underlying trauma. So it is actually the trauma that is causing these symptoms of anxiety and depression. And hence it is super important to sort of address it as well.
So it may not only be an aversion to a color.
Yeah.
It may be also more than that.
Yeah.
How can that be?
So even with depression, a lot of PTSD symptoms would look, post-traumatic stress disorder symptoms would look like depression, where the person is isolating, there's a loss of appetite, they're not able to sleep well, they might have nightmares and flashbacks from something that they've experienced. They might have intrusive thoughts. So it kind of looks a lot like having anxiety and depression. So if they're having flashbacks, they might even experience some of those palpitations and sweating and the breathing becoming shallow and all of that. So it's also just really important to sort of
So those are what you just said, the shallow breathing, and these are all, let's say,
Symptoms.
body reactions that also went ahead with the trauma that they experienced,
Right.
but more subconsciously, probably,
Yeah.
and that were not so as obvious as the yellow color, basically.
Just like a very random example from my own life sort of popped up. So as a child, when I was in kindergarten, at that point in time, I was learning how to write. And the teaching assistant, was very harsh with me because I couldn't do the letter U properly. And she used the word being stupid or something on those lines. I don't remember her exact words, but that stuck to me even as a 4-year-old or a 5-year-old kid. How did I cope with that? It took it upon myself to know everything about everything, so that I would never be called stupid again.
Because that was a bad experience.
Yeah, that was the trauma that sort of...
So the word stupid was the trauma.
No, the experience of being not able to do something and the humiliation that I felt or the shame that was associated with it was the trauma.
And then the trigger is the word stupid. Okay, good. Like the yellow color. The yellow color would be the word stupid. Okay. So, I mean, these are then the coping mechanisms, yeah?
Yeah.
How we cope with this situation. Everybody has a different way to do that. But then the trauma, obviously, for everybody, since we discussed already, it is a scar that remains in the brain.
Right.
It will pop up.
Yeah.
So if I would say, "Damn, Zahra, this is stupid," yeah, what you're doing, would you then have a bad reaction, or what happened to
Not
you?
anymore, because like now that awareness has come into it, so I've stopped acting like the 4-year-old Zahra who would have thought that she was stupid and felt that shame as an adult too. Like, I'm not that kid anymore.
But somebody else would probably freak out if I say you're stupid.
Yeah.
I mean, you should never say you're stupid.
Yeah. I mean, it's like now that button is no longer a button.
Yeah.
So you can keep pushing it for me.
Yeah,
And
yeah.
like if I told you, Dr. Mark, you have beautiful hair,
Yeah.
you're going to laugh at me.
I want to go for a hair extension, actually.
Like you won't believe me because you
Yeah.
don't have hair.
Yes.
And so that button isn't there. So
Yeah.
if you called me stupid and I didn't have the button where I
Yeah.
internally believed that
Yeah.
I was stupid,
Yeah.
it's not going to affect me anymore.
Yeah.
But that button was placed through having that really humiliating experience back then.
But by the way, when I was little, I had beautiful hair. Yeah. just to let you know, I had like a afro. hair. Yeah. Big. It was Dubai. Chlorine in the water, or I don't know. But I like this hairstyle actually also.
Oh, it looks really good on you.
Thank you. Let's change the topic. Yeah. No, let's talk a little bit more about trauma. Do you have more to tell about trauma, or is that it, basically?
Do you think this is good?
No, I don't think. I think it is still unclear.
Unclear
Yeah?
what?
Why should I go and meet a psychologist if I had a trauma?
Why should you go meet a psychologist if you
Yes.
have trauma?
Yeah.
Okay. So just coming back to this yellow curtain example,
Yeah.
since we've said it multiple times
Yeah.
as well already. So this lady who had that experience with
Yeah.
this yellow curtain as well,
Yeah.
she really struggled, not only because of the yellow curtain, but the trauma also defined how she was relating to people in her surroundings as well. Because in her childhood, she didn't have that sense of like having a secure and safe attachment with her parental figures.
Now I understand. Basically, it's like this. If somebody has this kind of symptom, like a trigger symptom or so,
Right.
it may be just the tip of the iceberg.
Yeah.
And it may actually only be the sign
Yes.
for you to dig a little bit deeper, because there is
Yeah.
much more improvement for you, or much more suffering inside your psyche
Yeah.
from the trauma.
Yeah.
Because can even get triggered from a color yellow or so. Yeah.
So that's just that's a trigger, but the root cause is completely different. So
And
the
bigger,
yellow,
bigger.
it's much bigger.
much
So it could be then like a
Now I
belief
got it.
system that I'm unlovable, or
Yeah.
like I'm not good enough, or
Yeah.
in her case it was like I'm too much.
Yeah.
So every time she sort of spoke and expressed herself, her authentic self truly,
And
she
now,
faced rejection.
And then this can be an accumulation of many traumata, and
Yeah.
then this needs to be unraveled.
Yeah.
And for that, obviously, to unravel that, you need to have a psychologist,
Yeah.
and the psychologist. But then, when you find out, okay, these are the problems that the person encountered,
Right.
and this is what happened, and I hear all about these stories and so on. What is then the effect of the therapy? Is the effect that my life will be completely different, or?
Yeah. So what therapy is actually in essence trying to do is to help you stay and react from the present and not from the accumulated emotional baggage of the past. So that's what the goal of the therapy would then eventually sort of turn into, to create that awareness and help yourself stay regulated in the moment. So even if this client was put in a room full of yellow, in the moment the yellow is not doing anything to her.
You know what? I understand now everything. Yeah. Now I understand also this can actually, this yellow, this little
Yeah.
sign can be like only the beginning of a
Yeah,
depression.
yeah.
So basically, because everything, this whole baggage that is not visible is carried by the person with her
Yeah.
or him, it's difficult for them to be proactive for their bright and good future.
Right.
Yeah?
So again, if we were to break this down even more, so this lady with the yellow curtain story,
Yeah.
if her colleague was wearing a yellow T-shirt,
Yeah.
she would just be very like
Aggressive.
and be very like loud and harsh with this person. Now, as a colleague to this yellow curtain lady, it's like, what is going on? Like, why are you behaving this way with me? So this person is staying in the present grounded. There's actually no real conflict, but because this human being is so triggered from all of that emotional baggage, it's then surfacing and coming out like that, if that makes sense.
Yeah, it makes sense.
Yeah. And then there's this, so then there is conflict happening in her present life
Yeah.
over something that was a past experience.
But not everything is connected to yellow than the conflict that's happening.
Yeah.
So there's more.
Yeah. But the
And-
yellow T-shirt is a trigger to her. It represents her turbulent relationship with her parents, which then kind of looks at like what belief systems she's sort of internalized and believes about herself.
So how do you? I mean, the person may not really come to you and report about the aversion against the color.
Yeah.
It may be that they just say something is wrong with me. I
Yeah.
think I'm acting overly aggressive to
Yeah.
people and
Yeah.
I'm casting myself out or so, and I don't know why I'm doing this.
Right.
And then on the way, you will also
Yeah.
find out, hey, if this
Yeah.
is the reason why you have an aversion
Yeah.
to this color.
Yeah.
Uh,
But it's not the color is just the trigger. So in therapy we might actually even use the color to sort of help this person keep on going deeper.
So is most of your work digging for old traumata and finding a resolution, helping the people to get peace with that?
Yeah. So it's not just about going into the past and digging because we're not paleontologists.
Yes.
So we're not looking for skeletons.
What? So-
Paleontologists.
Paleontologists.
Yeah, we're not those guys. The idea is to help the person build that awareness that this is coming from a past experience. This is not what's happening in the present.
Yeah.
So then to build the coping skills to stay in the present so that they can have a functional life here on.
What is the best coping skill?
There's different coping skills for different things, but it's just about kind of one of the easiest things to do is to sit in a comfortable chair, since we spoke about
Yeah,
the chair,
yes.
and just kind of really noticing how you're
Speak to
feeling in
somebody.
your body. No, not even speaking, right? Just noticing how you're feeling in your body. Because the minute you start to focus on your body and the sensations that you're having, you've kind of taken your brain away from the past and brought your brain into the present. And then with the present awareness, you then can kind of choose how you want to respond versus having a reaction from the past.
Amazing. And then once you have solved this, you can become rich and famous.
Of course.
Amazing. So, Zahra, you are the one to go to with the traumata. Yeah, if you have a trauma, or if you feel like
Sometimes it's really hard for people with trauma to even come in
Yeah.
because they've sort of created this entire sense of like isolation
Yeah.
and disconnect from everything and anything because it's so painful to sort of have that.
But I think maybe it's good. It's a good exercise for everybody to just think about their past and think what could be the possible traumata that I have
True.
had in my life, and if something pops up, maybe double check with a session with you
True,
if there is more to do about this. Yeah.
Yeah.
Because it could really help for a successful life. Yeah.
Yeah. Like it really helped me if I have to just
Yeah.
talk about myself.
Yeah.
Like I beat myself up through school and university where everyone would study from one textbook and I would have like 5 of them there because I'm like, I need to know everything all the time. Just because like that version of myself was avoiding to feel that humiliation from being called stupid. When I kind of became aware of this, it immediately sort of like I can now see my adult self being like, that was
So now you're not reading anything anymore. Yeah?
no more. Now I just talk.
Okay, thank you very much, Zahra. That was very nice talking with you about the topic of traumata.
All right.
Amazing. So we should make more topics. I think there are plenty of
Yeah.
other psychological issues
Yeah.
that are worth talking about. And if anybody has any questions, they can write them in the comments. And also, obviously, you can reach Dr. Zahra here in Mueller Medical Clinic. She is nearly always available, at least for a short telephone call, and then to schedule a meeting or so. Yeah.
For sure.
And I can only advise you to meet Zahra Poonawala, because I'm very confident that she can solve your problems.
Yeah. And I'm happy to help in any way
Thank
that
you.
people need help. Yep.
Thank you. Thank you, Zahra.
Thank you.